Party President Paul Mashatile says government remains committed to the fight against the abuse of women and children and people with disabilities. South Rand Hospital has until Monday to settle 2.9 million rand electricity debt with City Power or face disconnection. A second hostage and prisoner exchange has taken place between Israel and the Palestinian military group Hamas. The exchange follows a delay of several hours of tense negotiations. A very good afternoon. We're coming to you live from our studios here in Auckland Park, Johannesburg. Thank you very much for tuning in. You're watching The Week Ahead. You can interact with us on social media platforms. It's at Week Ahead, and our hashtag is The Week Ahead. I'm your host, Mfundo Mabalan. Leading our bulletin this hour, EFF leader Julius Malema is on the 2024 elections campaign trail. He'll address the party's Ground Forces Forum in Bloemfontein in the Free State. Yesterday, he told supporters in Limpopo that the socio-economic challenges that plague South Africa today should not exist 30 years into democracy. SABC News reporter Makhala Masiteng is covering the story and joins us live with the very latest. Good afternoon, Makhala. Can you just take us through exactly what some of those have gathered today are expecting to hear?
Thank you very much. Yes, we are still coming live from the Free State, where we are expecting the leader of the party, EFF, to address the ground forces in the Free State as they have started arriving. Of course, this is a build-up for next year's national and provincial general elections. We have seen the party leader visiting various provinces, of course, addressing members in terms of how they are expected to conduct themselves as they start with the campaigning. But with me here, I have Thembi Msani, who is the Free State convener, who will talk us through the work that they've been doing, of course, on the ground as they wait for the party leader to come and address the ground forces. Thank you very much for joining us. I know you've been in the Free State for quite some time now. What is it that we can expect, especially from the side of the EFF in the province?
Well, you can expect a total victory in 2024. We want nothing less but to be the ruling party in the Free State, noting that all political parties are at their weakest in the Free State. So you must expect total victory.
What is it that you have done? I remember in the past, the party leader, when we were in the Eastern Free State after the victory of the Ward 17, he was confident that the party will come in Mangaung, will be able to take those 4 wards that were up for grabs. But you didn't really make it to that point. But what have you done as the party on the ground for you to be this confident that many parties are at their weakest at this moment in the Free State?
Let us discuss those results of the 4 wards. We experienced dramatic growth. And if you remember, 49, we lost with a very close margin. And after those by-elections, we've just been busy with voter registration because we want new voters who are fresh, who will be convinced that the EFF is the only hope. So we're doing mass voter registration and we're doing mass recruitment.
Let's talk about even the recruitment. I know the party engaged in a campaign where you were going for millions and millions of members. Are you winning in that?
Most definitely. The Free State has got its own target of 574 new voter registrations that we need to meet by the time we go to the elections in 2024. And you will hear when I do my presentation inside, we are progressing very well.
What can we expect? Here the ground forces, they are here to listen to the leader, of course, to get those marching orders for 2024 general elections. What can we expect?
Well, the Commander-in-Chief has been going around the country afaga umhlahlandlela on how to behave, how to campaign, political tolerance, and make sure that our campaign is clean. Because as you may know, there are people out there like the AfriForum who are looking up to us to say that they are going to disqualify us. So we want a clean, fair campaign and making sure that our people understand the importance of their vote.
Thank you very much. That is the convener in the Free State. Of course, looking into how the party prepares itself for the upcoming elections. She's talking about what they've been doing as the party on the ground, getting ready, of course, for the victory that they say they are ready for come next year's general elections. She did indicate, of course, when we talk about those by-elections in Mangaung, where they were hoping to get those 4 wards that were up for grabs, that actually they have improved. In fact, talking about Ward 49, where she says that they actually lost by a few votes, and also indicating, of course, in terms of recruitment, that they are hard at work, making sure that in terms of numbers, they are increasing those people who will be voting come 2024 general elections. And of course, we are waiting to see the party leader coming forth to address the ground forces. But as she also indicated, that she will be tabling a report on how the party in the province has been progressing in terms of recruitment, and as well as the ground work that they've been doing up to so far, as they get ready, of course, for that 2024 general elections. We know that the date has not been declared, but we have seen on the ground that the parties have kick-started their campaigns, of course, getting ready for that elections. We had the party leader in the previous visit in various provinces saying that the 2024 general elections will be like those in 1994, and the fact that if 1994 was for political freedom, 2024 will be for economic freedom.
Now, Makgatla, just before I let you go, can you just give us an indication of when exactly the leader of the EFF is expected to address the ground forces there?
I am struggling to hear you. You want to hear what?
And we just wanted to get an indication of when exactly now are they expecting the leader to address the ground forces? All right. Makgatla, it's okay. Unfortunately, she cannot hear us there. It is a bit noisy as most of them await the leader, Julius Malema, to come through and address them in Bloemfontein. Well, that was Makgatla Masiteng in the Free State for us. Now, still on political parties on the campaign trail, ANC President Cyril Ramaphosa is leading the party's election campaign today. This is in Jozini, KwaZulu-Natal. Part of his program will include meeting with traditional leaders to, among others, discuss the water challenges in the area. SABC News reporter Mlondi Khadebe is covering the story for us and joins us with the very latest. Good afternoon, Mlondi. So the president is in Jozini today. Just firstly, take us through the challenges faced by the community there.
Thank you very much. We are here in Jozini in Bambanana Stadium, where the president of the ANC, Cyril Ramaphosa, is expected to address the communities in this area. You'll remember that the Jozini area is known for to have a big dam in South Africa. The Jozini Dam is one of the biggest dams in South Africa, and also the residents of this area, they've got a challenge when it comes to water. They don't have water in their area, but they live next to the biggest dam. Those are the complaints, or those are the issues that the residents of Jozini are raising in this time. And they're also saying that they don't have access roads. Sometimes if you want to send your child to school, you'll have to cross the river with the child at your back, and then to try and make sure that that child is able to get to school. When it's raining, sometimes they are not able to go to schools, but they are saying that they will address all those issues with the president today, and they are hoping that that will assist them in getting a better education for their children. Also the residents in this area, they are telling us that the cross-border crime is also an issue, because when you remember that they are bordering Swaziland as well as Mozambique, so they are saying that the cross-border crime is also an issue in this area. I'll just speak to the residents of this area just to find that if we can just speak to one of them in relation to what we can speak to them in relation to the issues. Baba Sibonga kakhulu Sikhatha, can you give us your names and your designation?
Stanley Mchangase, Sikhumbuzo.
Baba Mchangase, briefly about the issues of the residents of Ejozini. What are the issues?
The issues of the resident here, we've got the shortage of water, as well as electricity and the road. But due to the assistance of the ANC, some of these issues have been reduced, but they are still there.
We remember that the last time we visited the area, the community were complaining about the cross-border crime. What is your take in relation to that?
Yeah, the border crime is a problem, but now due to the interference of the ANC, where they have eliminated a lot of challenges, here it has been reduced. Although some of our comrades have died due to the challenges of the border crossing of the community cars.
Thank you very much, sir, for your time.
Thank you.
Basically, the residents, they are telling us that the crime is still there, but it seems as if it's been reduced in the area. But today they are just waiting to see the president of the ANC, Cyril Ramaphosa, addressing today's rally. Earlier on, he met with Amakosi in the local authority, and then he went to a water scheme where basically he opened or launched the water scheme for the residents of this area. Back to you in studio for now.
Thank you very much, Mlondi. It seems the water challenges are in fact very pressing for the community of Jozini. Thank you very much for that. Mlondi Khatebe is our reporter that's on that particular story in KwaZulu-Natal. More news on the other side of this break. Do stay with us. Deputy President Paul Mashatile has called on everyone to collectively bear equal responsibility to put an end to gender-based violence in the country. He was speaking during the launch of the 16 Days of Activism for No Violence Against Women and Children campaign in Kapokweni in Mpumalanga yesterday.
A launch to collectively fight the scourge of gender-based violence. Community members came in large numbers to support calls to end GBV. With the alarming rates of gender-based violence in the country, the Deputy President has called on the law to play its role against perpetrators.
It must never happen. These people must be punished. Because if we don't do that, communities then take the law into their own hands. Because they are going to say, you see, the state is failing. So the state must be tough on perpetrators of violence against women and children. And they must mete out appropriate punishment. Ahamba umuntu ayejela ufela khona. Usabuya usonzani la. So they must get appropriate punishment labantu. We call upon our courts not to be soft against these perpetrators.
According to police statistics, the number of sexual offense cases in Mpumalanga has increased from 641 in March 2022 to 746 in March 2023. However, some arrests were made.
65% were referred for prosecution of these cases. But unfortunately, 34.4% were accepted for prosecution, about 18.5% went for trial, and of this, only 8.6% were finalized with guilty verdict of a sexual offense. This paints a very grim picture of our ability to successfully convict the perpetrators of gender-based violence.
6,721 GBV victims are receiving counseling from the Department of Social Development in the province. GBV victim Veronica Nkosi says such campaigns always remind her of her ordeal. On such days, my heart aches because it brings back all the bad memories of 2019. On the 13th of September, I was raped by my stepfather, and another thing that hurts the most is that he's out on bail. Also, the boy child was not forgotten. Government was asked to do something to keep them busy and off the streets. We are asking government to fix the stadium so that boys in this community can keep busy. They are bored and always on the streets. We don't want them to end up doing drugs and robbing people of their belongings. The national government, together with the African Union, will host a men's conference on Monday and Tuesday to highlight positive masculinity and fight the scourge of gender-based violence in communities across the African continent. Nhlanhla Jele, SABC News, Kapogweni.
Now, to review the campaign and some of its challenges is economic research associate Lisa Vetten, who's also studied feminist literature and domestic violence. Lisa, good afternoon, and thank you very much for joining us.
Good afternoon. Thank you very much for the invitation.
No, it's a pleasure. Now, we mark the start of 16 days of activism. The campaign started yesterday. The president addressed crowds in KwaZulu-Natal condemning the abuse of women and children. So did the deputy president in Mpumalanga, that particular clip that we were watching. So essentially, politicians and community leaders have become more vocal in their condemnation of the abuse of these vulnerable groups. But the question is, are the added voices or amplified voices yielding the desired results?
No, and I think we must really beware of spending so much time and energy and attention on what are really just events. Events have their place, and it's important for politicians, especially male leaders, to be speaking out against gendered forms of violence, but it's woefully inadequate. So when we look at where we're putting the bulk of our efforts and our money, it really should not be on events. It should be going into things like services, like skill development and training programs, a range of different activities that will make the real difference. Because, I mean, there's just so much, I'm afraid, that violence men listen to, and a vast amount that they actually just ignore.
I want us to delve deeper then into some of these services, because you actually state something that many activists have stated, that for them it's not even about educating women anymore about what abuse is. They know it, they understand that they're being abused in particular home settings, but what they really need is alternatives. That I do know that I'm being abused, but I need an alternative. Do we have enough adequate shelters to accommodate these women? Are we empowering them that financially they can now leave that particular home? So what happens in this respect when still we have activists that say there are more events than the actual alternatives that women are looking for?
Yes, and I think that's very much part of the problem. You know, listening to the Deputy President beforehand, it's clear that government is obviously very essential to trying to tackle the problem holistically and comprehensively. However, at this point in time, I think it's not a particularly original or profound point to make, is to say that government is probably the weakest it's been in close to 25, 30 years. So when they are as weak as they are, it is very difficult to reach and run programs at scale. I mean, right now, I think shelters would really benefit from being attached to skills development and job employment programs. But with the economy in the state it is, and government not having shown much creativity or success in generating jobs, it means that we can say what we like, but the actual reality is that there's not a lot happening out there. And that's really where one would rather see efforts going, is into thoughtful, careful consideration around what do we do to improve women's employment prospects. And I have to say, you know, it might be a year or more since the COVID lockdown, but one of the areas in which government put no real effort was the NGO sector. So, I mean, many other sectors got all kinds of programs to help get them back on their feet, but not the NGO sector offering these kinds of programs and support. So I think they've had a double knock-on. They're both getting having the cuts passed by Treasury passed on to them, and they're still dealing with the after effects of the COVID lockdown. all of which then combine to limit what can actually be done to actively prevent, intervene and respond to situations of violence.
I want us to shift our focus to the legislative aspect. Parliament is among those institutions that have in fact a great role to play in passing laws that protect the rights of individuals that are abused. And we know a number of those acts, from the Domestic Violence Act of 1998 to the Sexual Offences and Related Matters Act. Legislation is there. But interestingly or sadly enough, every other day, we're seeing videos that surface of women or children being abused. Where is the disconnect here?
It's at a range of different levels. Firstly, law is important. It kind of sets social norms, and it does so partly by ensuring that there are consequences for those who violate those kinds of social norms. However, law is by no means enough, and many people don't trust the law for a range of different reasons. Sometimes it's just an unfortunately rather valid belief that the law is not going to be very effective. And if you look at our conviction rate for rape, they would be entirely right in drawing the conclusion that the law is not very effective. I mean, since 2016, we're seeing the number of cases being put down for trial in cases of rape declining. So it doesn't matter if you send 5 men to prison for the rest of their lives. The fact that 20 have gotten away with it and haven't been convicted means that the law doesn't then act as an effective deterrent. Because for those watching what's going on, they're seeing, sure, a couple of men will be held up as symbols of how effective the law is and given these very heavy sentences, but the vast majority will never see the inside of a court. So I think we need to stop focusing on demands to make sentences harsher and look at the quality of policing, look at what's going on in the courts. So, I mean, things like what we're seeing now, the cuts that are being inflicted on the National Prosecuting Authority are deeply, deeply concerning, because that is, again, going to have an impact on the number of cases that are being set down for trial. So I think we have to start taking a much broader look at what it is we need to do.
And I suppose even with the police service itself here, because you've got detectives that are dealing with piles and piles of cases. So it really becomes too much for themselves. It's just overwhelming. So they don't get enough time to really investigate some of these cases. But if we had to look at community members' role, because ever so often we hear, when we look at the statistics, most of them indicate that this abuse takes place at the home of the perpetrator or victim. So it's mostly people we know, which one would say probably lends credence to the fact that it cannot just be a solution coming from law enforcement, but also ourselves within our communities, because we live with these perpetrators.
Exactly. And then I think is the point about social norms. It's not just the law that keeps people in check, it's also the way we engage with each other. We also keep each other in check. So I'll give a recent example which shows both the best and the worst of what it is that communities do. So the student, for example, who was stabbed by her husband at CPUT, you had somebody standing by and filming that. They weren't intervening, they were just standing, watching and making a video of this. And then you had students who did intervene. So, I mean, under those circumstances, quite clearly the courage and bravery of those who prevented that woman being murdered is what we want to encourage. It's what we want to see bystanders do. We don't just want to see them standing back passively and thinking about the video that they're going to release on X, TikTok, or their Facebook page. So, I mean, that is an example of how we need to be intervening better, is when we're seeing it, to be doing something about it. I think we've also seen, and I mean, there's just other examples in which you can train communities how to intervene, because I think often people are worried about, if I hear my neighbor shouting and screaming next door, what do I do? And there are bystander programs that you can use to search people how you can intervene and stay safe at the same time and ensure the safety.
Yes, I'm glad you mentioned the safety aspect, because many people would think that the best I can do is to film in such a situation, because if you physically intervene, perhaps as a woman, you too get stabbed. So at least you were able to document this, and then the police can use it.
I mean, there are different things one can do. Like, if you have a phone in front of you, call the police immediately. The other thing to do is to make an extremely loud noise, because that is also that's distracting and disturbing and disruptive, and it brings people running to you. The other thing you can do is throw things, shout. If you are near water, get water and throw it on them. There are different things that one can do in order to intervene. But often I think just making a very loud noise and attracting attention is what is significant.
That particular case involved now tertiary students. There are many of such incidents. And one wonders, when you have young people mimicking what adults would do, because in most instances perpetrators would be older, whether it's intimate partners. But now when we're seeing younger people sort of imitating what older people are doing, what does it say about us as adults? Where are we failing?
I think actually if we look statistically, the group that is most likely to be perpetrating violence is young. And especially young men. So I think around about in the age of about 16 to about 35, that is the age category in which you see the overwhelming amounts of violence being perpetrated. So it is why it's really important to target schools, to target universities, because that's the high risk group for violence. It is important to be doing things at that level in order to prevent and stop violence. I mean, part of the reason why you see a certain amount of violence in that age category is because they're still very impulsive. So it's really very important, I think, for whether these are school or university programs or at home, to be able to teach young men not to behave impulsively, to stop and think, and to learn how to control their emotions rather than simply reacting. I mean, we do see as men get older, they age out of violence. So it is important that we put a lot of focus on younger men if we want to dent violence.
And then over the years, we've been observing some sort of a regression. I'm not quite sure what the statistics show or research on paper, but what we've seen on social media is a shift. There was an era where feminists in the 20th century were being celebrated, but now feminism has been reduced to male bashing in some quarters, where there seems to be some sort of regression now, where those who want to stand up for women, even as men who are advocates of women's rights, they're also being bullied. Have you seen that in just research, just on paper? Is there in fact a regression?
If we look at the number of figures being reported, then there are some very worrying signs of us going backwards. The high point of violence towards women in South Africa was in the 1990s. If we look at our figures for rape and femicide there, we did accomplish a decrease. But what is very concerning is the increase in the number of women being murdered. The last 2 years have seen a definite uptick, and we've seen figures crossing over the 3,000 mark, over the 3,000 women dying mark, which we haven't seen since the early 2000s. So that's very concerning. And we do have to ask, what is going on? Why, during this period of heightened attention to the problem, people calling each other out left, right, and center, lots and lots of programs, why is this increase happening? And for me, I'm a researcher, so I am going to say this. I think this has gone hand in hand with the disappearance and the decline of research, so that we don't know what is changing in South Africa. We can suspect, with worsening economic conditions, that it might be related to that, as well as the general increase in violence overall. But because we have now, as you say, just resorted to fighting on social media, I think we're missing the larger, bigger, deeper, and more difficult questions as to what's going on. And that very definitely needs to change. Simply trying to shame men is not sufficient. And in fact, there is some very important research that tends to suggest men who use violence are men who already feel very prone to feeling ashamed, and that violence is often the way in which they respond to their shame. So if that is correct, then trying to shame them further is not going to be helpful. It's only going to exacerbate violence. We have to think of other more effective ways to change behavior than just shame, although shame will have its place.
A very interesting perspective. And then your views on just the lack of attention on the subtle abuse, because we're seeing a lot of the overt abuse getting attention, where somebody must be physically assaulted or there must be rape. But the psychological abuse of women in relationships is getting very little attention. When there's condemnation, even from men, I don't know if they don't view it as abuse, but it gets very little attention. Psychological abuse, the withholding of children's maintenance, where you have your wife or ex running up and down maintenance courts, all of that is a form of abuse. It abuses the woman. It abuses the children, who then have some sort of an absent mother who is either on antidepressant, always crying, and all sorts of things. This kind of abuse, which isn't so overt, is hardly spoken of. What do you make of that?
You're quite right. I think South Africans are very well attuned to very sensational and dramatic forms of violence. And because there's no shortage of that, it tends to make the other violence look almost ordinary and invisible. And as you're pointing out, that is a real problem. I mean, if we look at applications for protection orders, the bulk of protection orders mention emotional abuse. But it doesn't get the kind of attention that it should. And I think many of us, if I think of myself in my childhood, being told, oh, sticks and stones will break my bones, but words will never hurt me. And yet words are extremely painful. They cause as much distress as physical violence does. And I think a lot of men, because they're not physically violent, don't think that what they're saying is harmful, hurtful, or abusive, and think that they're actually quite good and decent human beings because they don't hit. But their other behavior is not being questioned. So we see that psychological and emotional abuse not being attended to in relationships. I think we also see it in the workplace, that sexual harassment and gender bullying, again, because it's not leaving dramatic injuries, is being completely overlooked. This is very much the case in universities. There's great focus on rape and femicide, but the everyday catcalling, the names, the subtle undermining of your dignity, that just goes that just falls to the wayside. And what you're saying about economic abuse is really very important. We know a lot that adversity in childhood, and that can be, even in a middle class setting where you have all your material wants attended to, that emotional neglect also sets one up for loneliness, isolation, and a way of dealing with difficulties in your adult life. That is destructive, that is abusive. So it's really important that we look at the many ways in which people are deprived emotionally and economically, and how that relates to violence. Because I think there's also something else, is that if you have not received love, and this is regardless of your economic background, if you've not been loved and appreciated, for you as an adult, if that's never been shown to you, you will have difficulty in being able to demonstrate that to others. And so the cycles continue to perpetuate. So it is important that we look at these less dramatic and less sensational forms of violence and how they poison people's lives.
Lisa, thank you very much for your insight this afternoon. A very enriching conversation. That's Economic Research Associate Lisa Vetten, who's also studied feminist literature and domestic violence, as we continue to mark 16 days of activism against no abuse against women and children. More news on the other side of this break. Do stay with us. Welcome back. Thank you very much for staying with us. 1st of December marks the commemoration of World AIDS Day. The day will be observed under the theme, Let Communities Lead. This year's theme joins a growing list of challenges that World AIDS Day has altered or rather alerted people to globally. The observation of this day remains as relevant today as it's always been, reminding people and governments that HIV has not gone away. There's still a critical need for increased funding for the AIDS response to increase awareness of the impact of HIV on people's lives, to end stigma and discrimination, and to improve the quality of life of people living with HIV. For more on this, we're now joined by Dr. Musi Maganye, who is the Director for HIV Care and Support at the National Health Department. Doctor, good afternoon, and thank you very much for joining us.
Good afternoon, Funda, and good afternoon to your viewers.
No, it's a pleasure to have you with us. Let's get into this year's theme, Let Communities Lead, which is a way to encourage communities to play a role in how this disease is combated. Talk to us about this particular theme.
Well, thank you so much for having me. This theme, as you alluded, Let Communities Lead, it's a global theme in particular, which South Africa has adopted, and it was launched by our Deputy Minister, Dr. Sboniseni Domo, during the Rotary Health Days. So these are the theme in particular that really resonate with our national strategic plan for HIV, AIDS, STI, and TB for 2023 to 2028, which really talks to what we attribute as the motto of our civil society forum, which really attribute to the communities matters, because we believe that communities have to play a critical role in leading through the response to the end of HIV and AIDS epidemic, and especially as it relates to the planning for the response, the implementation, the evaluation, and also the monitoring in particular, because without communities fully involved and engaged, we run at the risk of not actually getting to reach our targets.
But are you seeing the kind of involvement that is necessary?
Precisely. I think starting off with our South African National AIDS Council in particular, the forum itself has actually established the communities to be at a prime role actually leading through the course. And within the department in particular, we do have forums that we are actually involving fully the people living with HIV and the communities in particular, in terms of ensuring that our planning and response is not the one that is one-sided, but is inclusive, so that we're able to really fight for the HIV response in particular.
Before we get to perhaps access to medication, let's start with the stigma. Have we seen an improvement over the years? Because we've come very far with HIV and how those who are infected and affected have been treated over the years. Have you seen a significant change in how people relate with individuals affected and infected?
Absolutely. And one of the critical attributes around the stigma and discrimination reduction is especially making sure that we let the people living with HIV to be driving through the course of the response. And this actually makes it easy for people to normalize when we talk about, knowing your HIV status, so that when you are positive, you can be linked to ARTs, which we know that they are lifelong, and they are able to really contribute towards the better clinical outcomes. And then, of course, one of it is to be virally suppressed, so that you're not able to really transmit the status. So this drive in particular has proven to be instrumental in terms of reducing the stigma and discrimination. We don't, we know that at the same time, stigma at some instances, especially when we have people who may not have knowledge and awareness of the HIV, we still have those isolated cases where stigma does actually still exist. But in a larger part, and as we look into the bigger picture, we have seen the reduction, especially in terms of the stigma and discrimination in particular.
Doctor, I've just heard you talk about those who are virally suppressed not being able to transmit the disease. This one is a very confusing one. The fact that not many people know about the U equals U. Every time we see them interacting among each other on social media, it seems this particular message around virally suppressed individuals not being able to transmit is one that is not reaching many, because they still don't know of this U equals U. What does it then say?
Fortunately, as the department and together with our stakeholders, SANAC in particular and other implementing partners, we have recently developed the guidance, which is the U equals to U toolkit. This is the prime focus to really ensure that we have a message that is tailor-made to guide through the implementers, to guide through the recipients of care, so that we are able to really make sure that what we communicate on what U equals to U means, we are able to make sure that people have a better understanding. For instance, when we talk U equals to U, we are saying if you have the virus and you are on treatment and you are adherent to a treatment, the chances are high for you to be undetectable. And therefore, if you're undetectable, especially from our context, which we attribute that from the 50 copies per milliliters and less, then you have a chance of not transmitting the virus to your sexual partners. That on its own becomes an incentive that help us to really know that when we have the adherence and people are retained, the chances are high that the benefits becomes massive, wherein you live a better health, and there are chances of reducing the stigma in particular. So these are actually guidance that we are now rolling out.
Apologies for interjecting there, but also it would reduce the new infection numbers, because if a couple comes together and one reminds the other that if you are a discordant couple or the person is taking this medication, then it might not be transferred. But some of this information, when we read of it, we find out that not many are aware of it. But what are the dangers even there? Because some would still argue that it would need individuals that are very responsible in taking that particular medication, that here, if people do away with protection, you could find yourself exposing your partner to the virus.
Precisely. So that's why we have made a caveat within the implementation of U equals to U, that prevention is central to the cause. So while we say that there is a status you could achieve by having the U equals to U, it doesn't take away and replace the fact that we still have to apply the combination prevention measures. For instance, the use of the PrEP, the use of condoms whenever we engage in sexual practices remain the largely focus in terms of us making sure that we don't confuse the initiative of U equals to A within the country. So that is why one of the other issue is that we're developing the communication strategy on U equals to U, so that we are able to have a uniform message and everyone is able to talk the same language.
You just mentioned another important acronym there, PrEP. That is pre-exposure prophylaxis, something that some might also not be familiar with that. Talk to us about what PrEP is and how it helps individuals not to get infected.
So this is the prevention measure or intervention, because we believe that treatment steps as a prevention outlook. So what we are doing on pre-exposure prophylaxis is that we identify people that are at risk of being infected with HIV, and these are the people that becomes an audience to be, or target rather, to be able to be initiated on ART. So this is largely to help them to stay on course, but at the same time not take away the fact that they still need to attribute to the prevention measures such as the use of condom, but it also helps them to minimize and reduce the risk of being infected with HIV. So it becomes critical that, you know, the people that are at high risk in particular, like pregnant women, your key population, and these are the main focus that we actually look in, and young people in particular, so that they are able to really lead the better health, where measures of prevention becomes instrumental in the course of our response.
So essentially, this is a drug that individuals can take on a daily basis to prevent being infected with HIV should they come into contact with somebody that is HIV positive. How accessible is this drug to ordinary people?
It is accessible in our private facilities. We have over 4,000 health facilities that are available within the country that are providing PrEP services. So we encourage the communities that really feel that they're at risk to be able to access the health facilities so that they can get more information on how it works. We have the materials that are available in different measures like social media that are able to help them to know what the PrEP is and how do you access that, and how do you make sure that you prevent HIV infection from yourself and even from your loved ones in particular.
I'm still a bit worried about the campaigning around this, just the communication, because, I mean, this could save a lot of lives, including PEP, which is post-exposure, where you have young children who might have been intimate, condoms break, they sometimes forget to go to the hospital or the clinic to take post-exposure prophylaxis, which is then the 28-day or 30-day medication to ensure that they don't get infected if the person they slept with could have been infected. I mean, these are some of the other things that young people don't know of.
I must say the awareness campaigns are myriad within our countries. We do have the information available in our health facilities and districts and provincial level, even at national, different platforms, media and social media that we do have, like your Twitter, the National Department of Health has got the WhatsApp line that is able to provide information in almost every aspect of, PrEPs or even HIV-related conditions and problems in particular. All those mediums are available to make sure that people do access this information, especially noting that prevention is very critical, and we should make sure that at all costs we make use and uptake these services that are made available.
All right, but I take it, Doctor, at least on World AIDS Day, it will be another opportunity for us to talk more and inform society a bit more. Thank you very much for your time this afternoon. That was Dr. Manganye speaking to us ahead of December 1st, World AIDS Day. More news on the other side of this break. Do stay with us. Welcome back. Thank you very much for staying with us. Now, South Rand Hospital has until Monday to settle a 2.9 million rand electricity debt with City Power or face disconnection. The distributor issued the public hospital with intention to cut off electricity supply after failing to keep up with monthly payments. But the Provincial Health Department says the notice was premature because it has demonstrated willingness to pay.
City Power embarked on yet another cut-off operation, targeting defaulting customers, including a hospital.
Here to City Power. I believe you guys have received the pretense.
South Rand Hospital was on the list of non-paying customers to be disconnected from the grid, but due to time constraints, the hospital was given until Monday morning to make a payment. The move comes just months after a High Court ruling which exempts hospitals, clinics, schools and police stations from load shedding.
We were here to hand over the job card to sensitize them that we are supposed to be giving them 4 hours so that they can evacuate their ICU patients so that they can move to other hospitals. As part of our rules, if we are switching off hospitals, we're supposed to be giving them 4 hours at least prior the disconnection. So we've sensitized them, we've given them the job card.
The provincial health government and hospital management were not pleased with the notice, citing a meeting which allegedly happened a day before being served with the notice to disconnect the hospital.
In relation to South Rand, I know that already the team had made a run of, I think, about 2 million that is currently being processed. And finance is obviously looking into that in terms of making sure that that amount is cleared as soon as possible to be able to service the debt, because there was never an issue of not wanting to service the debt. There could have been a delay in processing that particular amount.
South Rand Hospital is not the only one with an overdue electricity account. However, the provincial health government says it is in the process of resolving all outstanding debt. Balentle Mthethwa, SABC News, Johannesburg.
And that's where we leave it for today. We're back next week. Have a great day further.